The scientific literature examining sugar's health effects contains a troubling pattern. Studies funded by food and beverage industries systematically produce more favorable conclusions than independently funded research. Understanding this bias proves essential for evaluating evidence and protecting research integrity. Systematic reviews analyzing conflict of interest disclosures reveal stark outcome differences. Industry-funded studies are approximately 5 to 8 times more likely to conclude no significant health harms from sugar compared to independently funded research examining identical questions. This disparity appears across multiple health outcomes including obesity, diabetes, cardiovascular disease, and dental caries. The mechanisms generating bias operate subtly. Rarely do industry sponsors directly falsify data or mandate specific conclusions. Such obvious misconduct would generate legal and reputational risks. Instead, bias enters through study design choices, outcome selection, analytical decisions, and publication patterns that individually appear innocuous but collectively favor sponsors' interests. Question framing proves critical. Industry studies often compare high sugar intake to equally problematic alternatives rather than to optimal diets, enabling conclusions that sugar poses no unique risks. They may emphasize short-term markers while avoiding long-term outcomes showing harm. Protocol decisions about control groups, exposure definitions, and adjustment for confounders create numerous opportunities for subtle bias favoring predetermined conclusions. Publication bias amplifies funding effects. Unfavorable industry-funded results often remain unpublished, while favorable findings appear in peer-reviewed journals and press releases. Researchers funded by industry report pressure to downplay harmful findings or delay publication of unfavorable results. This selective publication distorts the overall evidence base appearing in literature reviews and meta-analyses. Researchers face financial incentives creating conflicts. Scientists receiving industry funding often secure subsequent grants, speaking fees, and consulting arrangements generating substantial personal income. These financial relationships need not involve explicit quid pro quo arrangements to influence research directions and interpretations. The mere expectation of ongoing relationships may unconsciously shape decisions. Institutional pressures compound individual conflicts. Universities value industry partnerships for research funding, creating climates where challenging sponsor interests threatens valuable relationships. Junior researchers particularly face pressures to maintain sponsor satisfaction to advance careers dependent on continued funding. Transparency requirements have improved but remain inadequate. Journal disclosure policies vary widely, with some requiring detailed financial information while others accept vague conflict statements. Even when disclosed, readers often lack training to properly weight conflict information when evaluating study credibility. Independent replication reveals the extent of bias. When researchers without industry ties replicate industry-funded studies using identical methods, results frequently differ substantially, with independent replications detecting harms absent from original industry-funded work. These discrepancies strongly suggest that funding source influences outcomes beyond chance. The implications for evidence-based policy prove concerning. Industry-funded research, despite bias, enters systematic reviews and meta-analyses alongside independent work, potentially diluting overall effect estimates and creating false controversies about well-established harms. Policymakers consulting scientific literature encounter manufactured uncertainty designed to prevent regulatory action. Solutions require multi-pronged approaches. Journals should implement stricter disclosure requirements and consider separate evaluation of industry-funded studies in systematic reviews. Research funding from independent sources, including government agencies and nonprofit foundations, needs expansion to reduce dependence on industry support. Academic institutions should prohibit certain conflict-laden arrangements and strengthen oversight. Researchers advocating industry funding restrictions face accusations of bias themselves, supposedly prejudging findings based on funding source rather than data quality. However, the systematic outcome patterns documented across hundreds of studies demonstrate that funding source predicts conclusions with troubling consistency unexplainable by chance. For consumers and clinicians evaluating scientific claims about sugar, funding source provides critical context. While individual industry-funded studies occasionally prove methodologically rigorous and their conclusions valid, the systematic bias means industry research deserves heightened skepticism. The evidence base from independent research, showing substantial sugar harms, proves far more reliable than the mixed picture emerging when industry-funded work receives equal weight. The fundamental issue involves trust in science. Public confidence erodes when research serves commercial interests over truth-seeking. Protecting research integrity requires vigilant attention to conflicts of interest, transparent disclosure, and institutional cultures prioritizing independence over funding maximization. Only through such measures can the scientific enterprise provide reliable evidence guiding health decisions and public policy.